Oftentimes the diagnosis of any chronic illness can be disheartening, and part of what I try to convey is that it's not something that is necessarily bad news. It's a condition that has existed prior to my diagnosis, but that I'm there to help them manage it and to help work them through it. Some of the chronic illnesses that I frequently treat are diabetes, high blood pressure, high cholesterol. Patients can be diagnosed with any chronic illness through a variety of ways, but most oftenly it will be through their primary care doctor, either with me or with a previous physician, and then be transferred in to my panel or under my care. So once I diagnose them with any chronic illness, the next step is trying to treat that illness, both with them, through them and their caregivers, me and any specialists that may need to be involved. I encourage all of my patients to try to take control of their own illness. I work with the patients, their family members, their caregivers, try to empower them to be a little bit more knowledgeable about their disease and help treat themselves as well. Some of the most important management is something that patients can do themselves. And I frequently empower patients to try to learn the most that they can about their chronic conditions, particularly diabetes or high blood pressure, and how best to manage it on their own. Some of the most important things are diet and exercise. I always encourage patients who have any chronic illness to frequently visit or contact their primary care doctor and try to involve them in their care from start to finish. Part of the management of chronic diseases is to have several specialists, primary care doctors, nutritionists involved in the care that you might receive, and the primary care doctor's job is to help coordinate some of that for the patient. Some of the advantages of being here at Tufts Medical Center are the access that I have to some of the specialists, particularly those that are involved with chronic care management. They communicate with me, and I am able to communicate with the patients, their caregivers, their family members, to help manage things a little bit more efficiently than they would elsewhere. Some of the specialists that I have relationships with are cardiology, pulmonary, infectious disease, nephrology, nutrition, rheumatology, some of the surgery specialties like orthopedics, urology, ENT. I think some of the qualities that it takes to be a very effective primary care doctor are those that allow me to reach the patient wherever they may be emotionally, physically, and try to teach them as much as they can, as much as I can, about some of the illnesses that they may be suffering from. And being in primary care, one of the things that I like the most is the long-term relationships that I establish with my patients. And so I think that those can be very rewarding, and some of those extra minutes that you take in clinic to establish that relationship can really set the tone for the rest of the years ahead.